understand things within the same context. So I'm not that challenging anything. I'm just a student who's trying to seek some more knowledge and guidance. What's the point of the Majuma?
Thank you, Chair. Chair, through you, I think, Chair, we should, I would suggest that we give the CEC benefit of doubt in that we have several standing orders in this house. So maybe let him go ahead and answer the question explicitly, and we move ahead. Because if we just go down the standing order, then we will not move for sure. Considering that we have several standing orders.
I'm not glad about the order, please. Answer your question, please. Proceed the questions. Answer. Proceed to answer the questions. I'm talking. Sorry. Perhaps this will have been very important. It's not that I was trying to take you around. But what I saw actually was that I wanted guidance. 153 is actually talking about cabinet secretaries, but that's story for another day anyway. Having said that, I think I had requested and I sought your indulgence, Honorable Chair, that we give whatever information that we have now, it goes to the answer, and before they close the business today, because we just need to edit this information, you already have it, and send it to you before they close the business today. So could you please allow us all the questions that we have asked, we answer now, and then we send you in writing before close the business today. Yes, we surely can. Answer the questions and submit any document you have to the Secretary, please. So maybe to remind my director, shared questions, you will answer the question on the revenue information, and then I will take the question on the farm.
And in terms of the automation, I must admit that we don't have an automation in our facility. We have tried to push this through, it was advertised last time, but however, the money allocated and what the suppliers quoted were not matching, and because of that, that tender was cancelled. That was the County Hospital, and the rest of our health facilities are also not automated. But however, the plan is underway to ensure that our health facilities are automated, all of them. Currently, we have started with the community units, which all the community units now across the county have been given a smartphone, and also the training is going to start this week across the county, so that this starts from the community unit and then across the level of healthcare services will be automated and moving forward. So there's a plan, but currently there's no automation. Okay.
Secondly, on the question of that was asked by Honorable Sheikh Mohammed on human resource, that was there in our response that we sent last week on actually even our staff distribution, and still it is there in a report that we will be sharing today. That in fact you also asked. On the question of ambulances, we are currently operating with ambulances that we leased from Red Cross, and 3 that actually do belong to us. But one thing that I do want to bring out clearly is that the whole concept of referral is something that we have revisited. Because one thing that we have done is that in our health facilities, for instance in Ijara, once we posted the specialists there, and also in the DAF, this is one thing that we have done for the first time. And it has reduced the need for referrals. And here we are not referring to self-referral. There is a referral policy in Kenya where a patient is supposed to be dealt with at a certain level, and then it goes up, and any referral is supposed to be done by the highest ranking cadre, particular doctor, and all that is supposed to approve. So we have posted a surgeon, a pediatrician, who has actually since gone for further studies, but we have actually initially posted him and a surgeon and also a gynecologist. And the major reason for referral option by these ambulances, And if I actually take you through the latest report that we have, even as yesterday, how many cases were referred or maternal cases. So when we post gynecologists or surgeons for that matter, who can handle CS or mothers with complications in the sub-county hospitals, then it makes less the need for referral. On that note, and they will share data on this, we'll share data on this in our report. I'm sure my team is taking note of that. But Garissa is the only county that actually has recently been studied as a county that's actually managing, and it was an international study actually. It's referral through WhatsApp actually, not in other digital system. And all the information we have here, and we could as well share how many have been referred and how many have actually been managed at the mainly in Ijara and Bedap and also Balambal, where we had the theater operationalized. The theater of Pura was also operationalized, but we still have some issues with the HR, which is related to the same national shortages that we have just mentioned. There was a question that was asked about, I think that was it, about ambulances, revenue, human resource. Let's give question 5 from Chair 6. Questions later, please.
The CEC has just answered 3 questions. It is prudent for us as the members that you give us time so that we ask some follow-up questions related to the 3 questions on ambulances, staffing, and also the automation of services.
Hassan, I have said it. Any follow-up questions will make it later, please. Question 4, you haven't answered one Waziri. Question 4. What's the question? The issue of ambulance is answered.
Question 2 is still pending. Question 2, how many government?
Yes.
Through Chair.
Yes.
Question 4. Has the government repaired all non-operational ambulances in all sub-counties? If no, what are your future plans? How has the non-operationalization of the ambulances affected the delivery of emergency medical services? Is there a maintenance and services schedule to prevent future breakdowns? That was the questions.
Okay. And then take question 5 and 6 so that you want to also. Yes.
Chair, you want me to also ask the question?
Yes, go ahead.
Through you, Chair, CEC, is your department working with KEMSA to address the shortage in medical supply? Are there alternative suppliers? And does your department have an inventory management at the health facilities? Chair, the other day, you remember I even raised in another forum this matter, the seriousness of shortages of medical supplies in our dispensaries. The other weekend I was in a place called Gilango, CEC, and there was not even one piece of Panadol in that hospital. The nurse was seated there and he was telling any member of the public who comes to him, go and buy the drug and then I'll administer or I'll give you an injection, and that's the only way I can help. And he told me he was in that situation from last year, October. And that is, I think, a serious failure in the part of the health provision in this county. Thank you very much, Chair.
Question 6, please. Yes, already? Okay, let's give time to Waziri. Okay. Maybe my director will follow me up on that, but on the question of ambulances, I have said that there is no non-operational ambulance that we have as it is now. We have 3 that we own, and 5 from that we have leased from Red Post. and they are optimally actually referring. And what I was actually referring earlier on, is one that actually is the last stage of being repaired, and that is the ambulance that was stationed at Delhi. No, it does not belong to a particular facility. Normally what our ambulances do is that they can even cut across sub-counties sometimes. And the one from Balambara sometimes it could be operating within an area that is near Bodogashe, and there is an emergency there. We will not say that in Balambara, it has to take care of that. So it is stationed there, but it does not particularly mean that it does not work in other areas. It works in also within those facilities. So there is that one that which I assure that in the next 2 weeks it has to also still be hitting the road. Having said that, in just the last 24 hours, just to show you how optimally we are working with the current ambulances that we have, we did just the last 24 hours as at this morning at 8 a.m. We had within Garissa town we had 2 local referrals. Bodogashe had 2 external referrals, which means it was referred from Bodogashe to be brought to Garissa County Referral Hospital. Balambara had 1 referral within Balambara and 1 external that was brought to the Level 5 hospital. And Masalani had 1 external referral that actually we do not want to discuss specific cases, but that one actually we have to refer post general because of the specialty that was needed because of something that was connected to some pathological tests that we do not have here. And most of these cases that I'm talking about, prolonged labor, a mother who had bleeding APH, a PET mother, a PPH mother, a coil prolapse, all of them are maternal cases. So that's why we are talking about when we strengthen our theaters and ensure that most of the cases that they handle can be handled within the sub-counties, then the need for the ambulances will be reduced. In fact, what happens is that it will be even at a lesser cost for us when we do not use the ambulances, but we can manage the cases within facilities. On the question of KEMSA, I'll leave it with the director to answer.
Thank you. And for KEMSA, actually, KEMSA is the first source of ordering for drugs in all government entities. And currently, KEMSA has only 50% fill rates in terms of providing all the essential drugs that are needed as health facility. 50%. And because of this, whenever we make order, we don't get whatever that is required from KEMSA. And this has created perennial shortages or out of stock drugs in our health facilities. So, and because of this, we have developed as another level of ordering through MEDS, which we have engaged, and we are signing an MOU so that whatever is not available in KEMSA, once we make the order in KEMSA, whatever is not available, we make direct order to MEDS so that at least we don't have any shortages for that matter. But currently, I must report that we, for rural health facility, we managed to get back the health centers and dispensary and the hospital. We managed to get 75% of what we needed from KEMSA. And the distribution has started, and most of the sub-counties have received their drug, except, I think, Lugo sub-county, because they normally use third party to deliver drug. The drug normally KEMSA deliver at Masalani, and then they normally take local transporters to deliver all the facilities in the room. But still, the distribution is ongoing. As we speak, some of the facilities are getting it today. And from level 4, level 3, and 2, 25% of what they needed has been supplied. And what 25% of what is not available, we are asked to do a part order through MEDS. and for the county referral hospital, and they managed to get 50%. And the other 50% we want to source it to meds. So I think if we move on that route, we address the issue of drug shortage across the health facilities. So that's
Just an advisory.
Chair.
Just one follow-up on that.
Just follow-up
Can I give
advisory.
the follow-up question?
Yes.
Chair, can I exhaust my...
You have a follow-up question?
Yeah.
Yes,
Yes.
I just exhaust
On the cancer
Start
issue.
from
the
English.
cancer issue.
Yes.
Chair, I just
follow-up
wanted
guys and
I wanted to ask the director, 75% is fair enough, but on the 25 we are talking about, how soon is it going to be available? Because those 25% will be the most essential and important drugs. So how soon are they going? And the other thing is, I have seen, and through the dispensaries, when I go through the dispensaries, there are a lot of supplies of non-pharmaceutical, what is it called, non-pharmaceutical items. So why don't you sometimes reduce on these non-pharmaceutical requirements and you give more of drugs? Thank you very much.
Through the chair.
Follow-up questions from Hassan?
Through the chair.
From Hassan?
Chair, let me first, sometimes we commend the department. It is the first time that you guys have given autonomy to level 2 health facilities and health centers to do their own, what do you call, procurement. Can I say, own source. It is part of autonomy to the health facilities. But the problem now here comes the reliability of cancer. You're talking about 75%. If you go to the dispensary, you won't get first line medications. Mr. Director and the CEC, through the chair, most of what is supplied by cancer to these facilities are non-farm items. I have seen, and I was a witness in some of the supplies by KEMSA. Yes, direct from Nairobi, the items go first to the facilities without even passing the county, not the sub-counties. But if you see what is there, I was shocked to see that there were no antibiotics. In the last 2 distributions, there were no antibiotics and there were no painkillers. Now, you talked about meds. I want you to elaborate. How soon will you make the MOU with meds so that at least the supply of these drugs should be seamless without knowing that KEMSA will supply 45% and then you dilly-dally to have the other supply made by KEMSA. I was part of the health committee some weeks ago in the professional, in the main county referral hospital together with some of my colleagues who are here. We were shocked to learn that the last time KEMSA provided supplies was in October. We are now in the month of March, meaning half a year there was no supply of drugs. Thank you.
Let me combine the follow-up question, then you
Thank you, Chair. Waziri and your team also welcome. Chair, before I comment, first allow me also to thank the health department, also to giving clarifications on matters concerning ambulance. That one I agree with them personally. For the ambulance, particularly on ambulance account, we have a standby ambulance. Thank you for that, Waziri and your team. The issue of cancer, although I agree the issue raised by Honorable Hassan Gele on the medics issue, particularly on antibiotics, but still there's also an improvement for that. Madam Chair.
What's the question now?
Now I'm coming to my question, Madam Chair. There's this question too, which directly concern on what are the strategies measures to address staff shortage across health facility in the county. That one has not come out clearly. I think the question is asking, and what we are expecting from the head, from Waziri and his team is, we need to get, we all anticipate that there is a staff crisis in this county, across this county. And in fact, the motion was particularly concerning on this staff shortage. Now my question is, what we need or what we expect from the Waziri and his team is, how many staff have been deployed in some counties? Because if I give you a good example, my ward, I have almost 4 dispensary and one health center. I only have 10 personnel. And if you look the gaps, it's almost 22. Now what we need to get from this health department, what are some of the measures they have taken to address those gaps? Mr. Chair, thank you for that.
Mheshimiwa Fadhili.
Thank you, Chair. Thank you, Chair. Karibu sana waziri and team. Appreciating the fact that the waziri said he has posted a surgeon and a gynecologist and whatever in Ijara. Still, the Honorable CCM cannot convince me that still not need there will be no referral cases, although the need will be less. Despite the Garissa County Governor guaranteeing Garissa residents that they will receive the utmost care and attention because of having the state-of-the-art ambulances spread across the county, Masalani residents outcry ineffective and delay ambulance service to attend to their medical emergencies, to evacuate patients to the closest facility for additional care. Kindly, as the head of the department, explained to this committee. And again, what do you want to see Waziri in the future concerning the health department?
Thank you, Chair. Waziri, from the onset, we need to appreciate the efforts that your department and the taking to make sure health services are delivered to the people of Garissa County. And I have 3 follow-up questions. And Waziri, I think you have seen in social media and you have been made aware by your staffs at the County Referral Hospital that the health committee visited the County Referral Hospital some 2 weeks ago. And when we were at the pharmacy, you know, there's this narrative among the people of Garissa, the drugs that are supplied the Garissa County Referral Hospitals find its way to the private facilities. When we were at the pharmacy, we inquired from the pharmacy in charge what internal mechanisms and strategies are there in place to make sure the medicine procured from Garissa County Referral Hospital is utilized by Garissa County Referral Hospital to not provide. So maybe you can shed more light on that. Number 2, on the issue of automation of revenue. As we are all aware, the FIF bill has not been passed by this county assembly. So our assumption is all revenue collected goes to the county revenue account, the CRF account. While we were at the Garissa County Referral Hospital, the deputy CEO and the person in charge of the accounts actually told us they have an account in KCB, but they do not directly deposit the cash to the account, but they have a holding account. A holding account where they deposit the money from Sunday to Sunday and then they transfer the money to the main account. When the committee further probed, your staff at the County Referral Hospital could not explain. And actually, you know, when we got interested, they were shocked. And I think I have some colleagues who were with me that day, the health committee. So, Waziri, are you aware? There is an account called holding account where all the revenue is being collected, and then on every Monday they transfer the money to the main account. And what is the justification for this holding account? And number 3, Bwana Waziri, I want you to tell this committee, and you are on live coverage and you are on Hansard, and this committee is an extension of the whole house. And whatever deliberation we make here, will find its way to the floor of this house. Are you in charge of the budget of your department? Are you given that autonomy in terms of sitting on the table and saying, this is what I require, these are my priorities. Ideally, are you in charge of your budget? Thank you.
Before I give to any member, Honorable Khadija, thank you for your question. As you are aware, what we have today is the reports and motions. And that one specifically goes to the PGH. And I think is that question she has it as a committee we have submitted and we wait to report from their side. And Khadija, kindly, I will not allow that question to go to the CAC. Let's give a final follow-up question to.
They call the CEO PGH.
Thank you, Honorable Chair.
Point of order, Honorable Chair, before Honorable Hamdi. Chair, this is an opportunity for even the committee to repeat its support. And whatever I ask is not outside the questions that are in this letter. Because when the director clearly said the revenue is not being automated. So if the revenue is not being automated, it means they collect it in cash. Where is this money going to? So I think I'm not out of order, Mr. Chair, although still I will abide by your guidelines. But I will request, the CDC and his team to give me some answers. Thank you.
Mr. President.
Chair, we need, our visit to County Referral Hospital and the report is with the Committee of Health. It's advisable that we leave because the committee is handling, the Committee of Health is handling, the chair was with us here. I think he's still here, the chair. Is the man who is mandated to undertake that. Any report or any clarification needed from the department, it should be through the department, through the health committee chair. So let's stick to the committee's mandated implementation.
Well, thank you for that clarification. I said again, Madam Khadija, I will rule you. Let's give a chance. Let's give a chance to CSC. Honorable Chair, still, if it's not outside the protocol, we may answer with your permission some of these questions because they are public interest maybe, and with your permission, of course, guidance. No, you have overruled me. I stand guided. There was the question of strategies of HR. Is my colleague head of the department who has not answered any of those questions. I think we have consulted and he will explain very well on those strategies. On the question that was raised on Ijara by Mishmua, first of all, I don't say that there is no need for what I say that we are using the need. And secondly, Ijara as a county has one police ambulance and one town pond. Right? I'm talking about Yara as a ghost face. Two. That is one list and one owned by the county. And the whole essence is that that other one goes to as far as Gulupo, so that the referral center, the main referral center for that area now is Sub-County Hospital. And then when a case needs now to be referred now, it will be referred. Still, as I said earlier on, there will be no coincidence where all our ambulances, the one for Gulupo, the one for Ijara, and even the one for Burra, which is within a vicinity, will all be engaged. So still, we can as well deploy that one from Burra to go out. So this sense of saying ownership, that this belongs to this area, this is not there for us. For us, it's about life saving, and which ambulance at that particular time is within close proximity, and that can save. We have a command center, and I wish if we had a projector, I would have taken you through how it actually works and how they actually communicate. So on matters of life saving, that's how we take seriously, and we are within trying to work on the promise and the pledges that, as you mentioned, the governor had met to the people of Garissa. Honestly speaking, without talking so much good of us, from where we were on the day the governor was sworn in,